Have you ever thought of acupuncture when you have an injury or pain? Maybe you have tried it before but didn't really see any results, or maybe you have never even considered acupuncture because you do understand how it works. Well, today we are going to explain exactly that. So stick around until the end of the video to find out everything you need to know about acupuncture. And do you not forget to like and subscribe so you can get more content like this in the future. Welcome to the Health Sphere, where we provide health advice based on our own personal experiences, research, and what's worked for others. This information is for general knowledge and should not replace professional medical advice. Remember that while online resources like ours can be helpful, it's important to consult with healthcare professionals for personalized advice and treatment. Let's start with a little history lesson. Acupuncture originated in China over 2,000 years ago and has been used for pain relief, stress reduction, and overall health improvement. It is a key component of traditional Chinese medicine. The word acupuncture comes from Latin, acu meaning sharp and puncture meaning to prick. In short, acupuncture is a form of alternative medicine and a treatment technique that involves stimulating specific points on the body using thin needles. The objective of acupuncture is to relieve pain and assist in the healing process. It is commonly used to treat chronic pain conditions such as back pain, neck pain, osteoarthritis, and headaches. Traditional Chinese medicine, TCM, which includes acupuncture, is based on the concept of restoring balance within the body to promote natural healing and overall well-being. According to TCM, health is maintained by the proper flow of energy, called qi pronounced qi, throughout the body. When this flow is blocked or imbalanced, it can lead to illness or pain. Acupuncture aims to restore the balance of qi by inserting thin needles at specific acupoints along the body's meridians or energy pathways. By stimulating these points, acupuncturists believe they can alleviate pain and restore optimal health. Now let's discuss how acupuncture is performed. An acupuncturist inserts thin, sterile single-use needles into specific acupoints on the body. The placement of these needles is based on the principles of traditional Chinese medicine and the individual's presenting symptoms. Typically, needles are left in place for 10 to 30 minutes during a session. Some people experience mild discomfort or a tingling sensation when the needles are inserted, but the needles themselves are not painful. After the needles are removed, many people report feeling relaxed and invigorated. To understand how acupuncture works, it's essential to grasp some basic concepts. Qi, pronounced qi, is a vital energy that flows through the body along specific pathways known as meridians. Acupuncturists believe that illness or pain arises when the flow of qi becomes blocked or unbalanced. Acupoints are specific locations along the meridians where acupuncture needles are inserted to restore the balance of qi. By stimulating these points, acupuncturists aim to alleviate pain and promote healing. There are several theories that attempt to explain how acupuncture relieves pain. One prominent theory is the gate control theory. According to this theory, pain signals are transmitted to the brain through nerve fibers. Acupuncture stimulation activates larger nerve fibers, closing the gates to these pain signals, thereby reducing pain perception. Another theory is the release of endogenous opioids. Acupuncture can trigger the release of natural pain-relieving chemicals called endorphins, which are produced by the body. These endorphins bind to opioid receptors in the brain, providing pain relief. Additionally, acupuncture may modulate pain perception in the central nervous system, altering the way the brain processes pain signals. It's important to note that acupuncture does not involve manipulating the spine. Chiropractic care, on the other hand, focuses on the diagnosis and treatment of musculoskeletal disorders, particularly those related to the spine. While both disciplines address pain, their approaches and techniques differ. Here are some examples of how acupuncture has been used successfully. For pain relief, a 2018 study in the Journal of Pain published a meta-analysis of randomized controlled trials involving acupuncture for chronic low back pain. The results indicated that acupuncture provided significant short-term pain relief compared to placebo acupuncture or no treatment. Another meta-analysis published in the Annals of Internal Medicine in 2010 concluded that acupuncture was more effective than usual care for osteoarthritis-related knee pain. A study in the New England Journal of Medicine in 2012 found acupuncture to be effective in reducing the frequency and severity of tension headaches when compared to a control group. While acupuncture is generally safe when performed by a trained professional, There are a few potential risks and complications to be aware of. One risk is the spread of infection if unsterilized needles are used. However, reputable acupuncture clinics always use single-use sterile needles to prevent any cross-contamination. There is also a small risk of nerve injury or bleeding at the needle insertion site. In rare cases, acupuncture needles may trigger an adverse reaction or allergy. Some individuals may also experience fainting or a vasovagal response during or after treatment. To minimize risks, it's crucial to seek acupuncture services from licensed and experienced practitioners who adhere to strict hygiene and safety protocols. If you're considering trying acupuncture, here are some tips to ensure a successful experience. Find a qualified acupuncturist. Look for a licensed and experienced acupuncturist in your area. Check their credentials and ensure they are in good standing with relevant professional organizations. Clearly communicate with your acupuncturist. Discuss your health history, current medications, and any concerns you may have. Be open and honest about your goals for acupuncture treatment. Ask questions if anything is unclear or you need further explanation. During your first consultation, the acupuncturist will ask about your overall health, including any past injuries or illnesses, and inquire about your current symptoms and pain. They will also examine you to identify specific acupoints for treatment. Based on your condition, the acupuncturist will develop a personalized treatment plan outlining the frequency and duration of sessions. They will explain the proposed course of treatment and discuss any lifestyle modifications or recommendations. As with any healthcare treatment, it's essential to manage expectations regarding acupuncture. While it can be highly effective for some, it may not provide relief for everyone. It's important to have realistic expectations and understand that multiple treatment sessions may be necessary to achieve the desired outcome. If you're seeking acupuncture for pain management, discuss realistic goals and potential outcomes with your acupuncturist. Understand that acupuncture is a complementary therapy and is often used alongside conventional medical treatments. Be patient and consistent. Give acupuncture a fair trial, allowing your body time to respond to the treatment. Consistency with sessions can help establish a therapeutic relationship with your acupuncturist. Communicate openly about your progress, and any adjustments to your treatment plan may be beneficial. In conclusion, acupuncture is an ancient practice with a rich history and a growing body of evidence supporting its effectiveness for pain relief and other health benefits. When performed by a qualified professional, acupuncture is generally safe. By understanding the basics of acupuncture, you can make informed decisions about whether to incorporate this practice into your own health and wellness routine. Remember to choose a licensed acupuncturist, communicate openly, manage your expectations, and be patient with the treatment process. We hope you enjoyed this video and learned something new. If you have any questions or comments, please drop them down below. Don't forget to hit the like button and subscribe for more videos like this in the future. Thanks for watching, and take care.